Hello, everyone. This is Qinghua Zhang. I come from Huzhou University, China. The topic of my report today is a behavior change wheel-based interactive pictorial health education program for hypertensive patients with low blood pressure, health literacy, a randomized controlled trial. I will make a presentation from the following aspects. First of all, background. At present, complications of hypertension are the leading cause of death globally and are extremely common in many low or middle income countries, causing approximately 10.4 million deaths worldwide each year. According to the American Heart Association, the number of deaths caused by hypertension is complications will increase to more than 23.6 million by 2030. Research has shown that the number of hypertensive patients in China is 245 million and is still growing. Health-related quality of life is one of the main indicators used to evaluate the health management of hypertension. Meanwhile, multiple studies have shown that health literacy is one of the main influencing factors for HRQOL in patients with hypertension. A completed cross-sectional investigation by our team confirmed that health literacy was a key influencing factor of HRQOL in hypertensive patients from Huzhou. In addition, health literacy is an independent predictor of blood pressure control and can predict a patient's health outcomes better than social demographic data. It has been proved that providing materials or information on communication skills for people with low literacy can improve comprehension for patients with both low and higher literacy. Conversation Map is a very practical interactive health education tool launched by the International Diabetes Federation. As an educational medium, pictures can lead patients to discuss with each other and realize a heuristic approach to answering questions. Different kinds of pictures have been adapted in health education for diseases such as stroke, bronchial asthma, and chronic heart failure. To date, very few studies have been specifically implemented to develop pictures and intervention strategies suitable for hypertensive patients with low health literacy to improve their health literacy. Addressing literacy through improved educational materials and intervention strategies is a potentially successful strategy. It's an innovative method to optimize patients' understanding, improve their health literacy and HRQOL, and enhance their self-care, self-management behaviors. This study aims to determine the feasibility and effectiveness of an interactive pictorial health education program based on behavioral change wheel theory and its effect on HBP-HL, self-efficacy, self-management ability, and HRQOL in hypertensive patients with low HBP-HL. Second, the methods. This is an RCT with a 9-month intervention and a 3-month follow-up. This program will consist of 2 arms, the intervention group and the control group. The participants will be recruited from the community setting in Huzhou, Zhejiang Province, China. Our researchers will give out recruitment lists in the 2 selected communities. This is inclusion criteria. This is exclusion criteria. Sample size calculation. The JPAR software was used to conduct the sample size calculation, and our final sample size comes to 120 participants, 60 participants for both the intervention and control group. Let's see Figure 1. This is a study's theoretical model. The behavioral change will consist of 3 layers. The center layer is composed of the capability, opportunity, and motivation model. The second layer is composed of 9 intervention functions, which are the general methods by which intervention might change behavior. Intervention. Participants in each group will be divided into 3 teams of 15 to 20 people. Intensive intervention will be carried out for 9 months and 12 months in the first 2 months. During the other months, the intervention will be conducted once a month. Later, 3 months of a follow-up will be conducted over telephone once a month, and hypertension-related knowledge and videos will be sent to the WeChat group once a week. Intermediary data will be collected at the 6th and 9th months to obtain timely feedback, to correct deviations, and to monitor and ensure the successful implementation of the intervention. This is an intervention component and a term about intervention group. This is a hypertension-specific conversation map in Chinese. The control group will only receive routine community lecture, health education sessions, 9 months of intervention and 3 months of follow-up. Outcome evaluation skills. Chinese high blood pressure health literacy skill, hypertensive patients self-management behavior rating skill, Chinese SF 36 health survey, chronic disease self-management program, perceived social support skill. This is our overview of the study procedure. Only partial results are presented because the article has not yet been published. From the table, we can see the intervention mean effects compared with the control group, the scores of the medication label dimension, the nuanced vital sign dimension, and the eating safe dimension were statistically different. There were statistically significant differences in the scores of high blood pressure, health literacy, and each dimension at the 4 time points. The scores of high blood pressure, health literacy, medication label dimension, the nuanced vital sign dimension, and the eating safe dimension were statistically significant. 2 group times 4-time repeated measure ANOVA methods was used to analyze the variation trend of systolic blood pressure and diastolic blood pressure at different time points in the 2 groups of patients with hypertension. There were statistically significant differences in the time mean effect and the interaction effect intervention times for systolic blood pressure. For diastolic blood pressure, the intervention mean effect and the time mean effect were found. Systolic blood pressure and diastolic blood pressure of the intervention group were significantly lower than those of the control group at T9 and T12 and its own baseline. From the figure, we can see that systolic blood pressure and diastolic blood pressure in the intervention group decreased significantly after the intervention and at the third month after the intervention, although they rebounded slightly. Systolic blood pressure and diastolic blood pressure will remain low than those before the intervention. The diastolic blood pressure and the systolic blood pressure in the control group also shown a downward trend, but their values were much higher than those in the intervention group. Discussion. The BCW theory-based interactive pictorial health management program was effective in improving blood pressure health literacy in patients with low health literacy and had better short-term maintenance effects, but did not significantly improve print health literacy. The reason maybe is print health literacy is an examination of literacy skills, which is closely related to the literacy level of the study participants, and is difficult to improve significantly in a short period of time. But studies have shown that adult literacy and numeracy skills can be improved through education and training. The BCW theory-based interactive pictorial health management program can be more helpful in controlling blood pressure. Some studies have shown that health literacy levels were related to systolic or diastolic blood pressure. The study confirms this finding. Research conclusion. The BC theory-based interactive pictorial health management program helps to improve high blood pressure health literacy and lower the blood pressure of hypertensive patients with low health literacy. In addition, the health management program is practical and feasible in the community context and has some application value and promotion significance. That's all. Thank you.